So good day, ma'am. I am Dana Delecano, your student nurse for today, and I'm going to demonstrate the bed bath. Bed bath refers to the procedure of giving bath to the patient who is confined to bed or is not ambulatory or is not physically or mentally capable of self-care. Bed baths are used to physically clean dirt and microorganisms from the skin of a critically ill patient, thereby decreasing the risk of infection. So the first procedure is assessment. Assess the client's tolerance for activity. Next is assess room temperature and ventilation. Next is planning. Wash hands and gather all necessary equipment. The next procedure is identify the client and explain the procedure. So, good day, sir. I am Dana Delecano, your student nurse for today, and I'm going to assess you on bed bath. So, is it okay to you, sir, if I'm going to assess you? And bed bath, sir, this is for you to, we're gonna use it to physically clean dirt and microorganism from the skin. So, and also proper hygiene, sir. So, ako takang trapuhan and everything. Okay, so basta mo, sir? Okay. So after that, I'm going to provide privacy to the client. I'm going to close the door and curtains. And next is I'm going to offer bedpan or urinal. So since we don't have any bedpan or urinal, so we're gonna just assume that I already given him the urinal or the bedpan. So the next procedure is we're going to adjust the bed to a comfortable working height position. So we're just gonna also assume again that atong
Using a bath blanket
ang
maintains the
kanang bed.
client warm
Okay,
and
we don't have
modesty
that
while
bed.
transitioning between
So,
clothing removal and
the
washing.
next procedure is we're going to place a bath blanket over the client before removing the top sheet. So assume that this is the bath blanket. And I'm going to remove the top sheet. So the next procedure is we're going to remove the client's gown, ensuring he or she is covered with blanket. So assuming na ako nang nahubo iyahang gown, so mo na to. So the next procedure is we're going to pull the side rail up and fill the basin with warm water. So this is
Positioning
my
the
warm
client
water.
correctly facilitates
So the
access for
next
bathing and
procedure
ensure
is
their
we're going
comfort
to
and
place the
safety
client
during
into
the
a
procedure.
semi-fowler position and remove the pillow if permissible. So we're going to position the client semi-fowler and we're going to remove the pillow. So pwede bangon ka, sir, and atras na gamay. Okay, so alibangon, sir. Dali. Bangon, Jade, atras, Jade. Okay, and
Following this direction reduces the risk
the
of
next
introducing
procedure is
contaminants
we're
into
going
the
to
eyes
make
and
a
promote
how
eyes
to wash
health.
clothes. So since we don't have that kind of thing, so I'm just gonna use this one. So the next procedure is we're going to wash the client's eyes from the inner canthus towards the outer
Gentle
canthus.
cleansing and drying of these areas maintains skin integrity and hygiene, reducing the risk of irritation or
And
infection.
other side. Okay. Next procedure is we're going to wash the client's face, ears, and neck and rinse, pat, and dry. So first is the face. Next is ears. Ay, ako sa ikuan. Ears. And then neck. And I'm going to pat a towel so to dry the face, ears, and neck. The next procedure is we're going
Methodical
to
approach
wash
ensure
arm away
thorough
from
cleansing
knee
and prevent
and
cross-contamination from proximal to distal
proximal,
areas.
including
Consistency
the
in washing both arms
and
ensure
using
thorough
long,
hygiene
firm
and promote
strokes
symmetry
and
and
rinse and
care.
dry. And I'm gonna repeat the procedure to the arm near me. So we're gonna start from the left side of his arm. So sir, distal to proximal and under and the axilla. And the arms near me. And the axilla. And then I'm going
Focusing on
to
hand
dry it
hygiene
with
reduces the risk of infection
towel.
transmission and promote overall cleanliness.
The other one, sir. Okay. So the next procedure is we're going to wash the client's hand in the basin and rinse and dry after. So sir, so okay. So I'm going to wash your hands. So we're going to wash the hands every kanang dinhi. Every fingertips, we're gonna clean them. Another one, sir.
Systematic cleansing of this area maintains skin health and hygiene, reducing the risk of infection or irritation.
Okay, thank you. So the next procedure is we're going to wash chest and abdomen using long, firm strokes and rinse and dry after. So first is the chest. Next is the abdomen. And then we're gonna dry with it with a towel.
Sequential washing of the legs
So the
ensure
next
thorough
procedure
cleansing and
is we're
promote
going to
comfort for the
expose
client.
one leg at a
Consistency
time
in washing
and
both
wash
legs maintain
far from
hygiene and
me
symmetry
or
in
far
care
from
provision.
you, and with long firm strokes and rinse and pat dry. So repeat the procedure on the leg near you or on knee. So we're going to expose one leg at a time. Okay, excuse me. And then we're gonna wash the leg far from me with long strokes. Okay. And next, the other leg near me. Next is I'm going to dry it with towel.
Focusing on foot hygiene reduces the risk of infection and promote overall cleanliness and comfort.
So the next procedure is we're going to immerse and wash the client's feet in the basin and rinse and pat dry after. Okay, sir. And please dip your feet in the basin. So, dip lang, sir. Sorry, yan na lang. Yan na ba? Doon na ba? And then we're gonna wash the client's feet. And then dry it. And then other foot. And then dry it again with cloth.
This approach ensures thorough
After
cleansing
that,
of
we're
hard
going
to
to
reach
replace
areas
the
while
water.
maintaining the client's
So
comfort
the next
and
procedure
dignity.
is we're going to turn the patient on his or her side and place towel alongside at the back and wash back and buttocks with long firm strokes and rinse and pat dry after. Okay, so ready to begin, sir. Okay, and then after that, we're going to wash the back of the patient with long firm strokes. And then after that, we're going to dry it with cloth or towel. Next is the buttocks. Using from the pubic area or the penis area to the anal area. Using one stroke only. And then we're going to dry it with towel. Or we can also clean the client's back of his legs, like exposed here. So we're gonna clean it and then dry it with towel. And we're gonna turn the patient back in a supine position. So the next procedure is we're going to place the client in a supine position and cover with bath blanket, and we're gonna wash the perineal area and rinse and pat dry after. If patient is able, place the towel under the buttocks and bring basin and soap within client's reach, and instruct the client to complete the bath him or herself. So we already positioned the client into a supine position. So now is we're going to clean the perineal area, and we're just going to expose the on the part where we're gonna clean it. So like that, and then we're going to like that, and then I'm going to use a towel, and we're going to clean the perineal area around the urethra of the patient, since my patient is a male. So
Respecting the
after that,
client's
we're gonna
privacy
clean
and
around
modesty
the
while providing thorough
urethra
perineal care promotes
of
their
the
comfort and
patient.
hygiene.
And
If the
side,
client is able, involving
wash,
them in the process empower them to
and
maintain their
clean
personal
again.
hygiene to the best
And
of
then
their
after
ability.
that, we're going to pat dry, rinse and pat dry the perineal area of the patient. So next is we're going to get back again, and then we're going to lay him on his side. Okay, sir. And clean the from urethra to anus area using long firm strokes, and then pat dry. Okay. Sir. The next procedure is have the client wear a new gown and comb hair, and apply lotion if the client desire. So sir, is it okay to you, or do you want me to apply your lotion? Okay, so assume that I already let the client wear new gown. First is I'm going to comb his hair. And then, since the client requests or desire to put him lotion, I'm gonna put lotion. Other one. So assume that I already put a lotion around the client's body or at the legs of the patient. So the next procedure is we're going to remove the equipment used and store them in a proper place. And next is I'm going to wash my hands. Next is evaluation. Evaluate the client's comfort. And lastly, documentation. Document the procedure to include the type of bath administered and the client's response.